Hi, Judy.
Hi, Nancy.
Thanks for being here today.
Thank you. We're so happy you invited us to come along today.
So what makes Polymem products so different than the others?
Polymem is a very unique product in the wound care industry. We're actually a polymembrane dressing, so we actually take the place of several of the other categories of dressings that are out there.
Oh.
This is a dressing that has the ability to be used throughout the entire healing continuum on any type of wound.
How does it work?
Here's what we call just our standard Polymem dressing, and you'll notice that it feels like
Well, a stretchy,
almost
foam.
a foam dressing,
Yeah.
right? And so many people assume that this is a foam dressing. But then we kind of begin to demonstrate it, and they see that it has a lot more capabilities than your typical foam dressing. For example, we're going to pretend this is some exudate.
Okay.
So if I take some of my exudate and I put it on the dressing, the very first thing that you'll notice is it doesn't stay there very long.
No.
And you'll notice that sort of bubbles into the dressing.
Yeah.
Well, if I flip it over, you'll notice that it's actually taken on the shape of the wound.
Okay.
We want it to go to the wound bed and take on the shape of that wound. And if you just rub a little harder, you'll notice one of the other components of our dressing is that we've embedded a cleanser right into our dressing. So the entire time that the dressing is in contact with the wound, the dressing is cleansing the wound.
Oh, at the same time.
At the same time. The slick feel in the shiny component that you see in the dressing, that's our glycerin. Glycerin has several functions in the dressing. The first one is it makes it non-adherent to the wound bed. So by being non-adherent to the wound bed, we automatically significantly reduce the pain that you have with the procedure of doing a dressing
That's important.
change. It is very important. Another wonderful component of glycerin is that glycerin is actually a sugar. It's a simple sugar. It's the only sugar that can be digested by a new cell without the presence of insulin.
Oh.
So when you consider that, you actually have a fuel source for new cells within the dressing. We have a starch copolymer, and the starch copolymer's value is that's going to control the exudate inside that wound bed. It's going to pull it in, and because it actually is embedded in our dressing, it's going to stay. There's nothing dripping.
So it takes all of it.
Correct. And if
Oh.
more of the exudate comes into the dressing, just more of the actual starch copolymer is activated, and it's controlled.
There's nothing.
Right, no,
Oh, that's
nothing, right
neat.
at the point of that dressing. The most important part is it's also an intelligent dressing.
Intelligent.
Intelligent.
Tell me more.
A lot of times clinicians want to look at the wound bed every day because they need to see whether or not a dressing needs to be changed.
Yeah, there's pickers out there.
But we have an intelligent dressing that actually tells you when it needs to be changed.
Oh.
Our secret is, prior to putting the dressing on, you outline the margins of the wound on the back of the dressing. Then, when it's fully saturated, you're going to be able to see that. You're going to be able to see that on the dressing and know when it's starting to hit the edges of those margins you drew, it's time to change your dressing.
Oh, wow. So it kind of like gives an alert signal
Exactly.
out
It is.
to the caregiver, which
it's
is
an
great.
Little alert alarm, not only to the caregiver, it's an alert to either the family member or to the patient themselves.
Everyone's in the loop.
Everyone's in the loop. So to do an actual dressing removal, they've seen it happens because it's very, very simple. Remove the dressing, doesn't stick,
Right.
diminished pain, do your margins, put the next dressing on. We often hear, because it's a nice cycle that goes through, so what we hear is that this dressing actually has the ability to be kind of disruptive.
Disruptive. What does that mean?
You think in the industry today, if you have a tunneling wound, you have to have a product
Yeah.
that may be made from one manufacturer. You would have to have a alginate. You would have to have, maybe you would use packing if it's a deep cavity. Then you would have to have something else to cover that wound. If you had a wound that needed moisture, you would have to be putting a hydrogel into that wound bed.
Yes.
Polymem's a little different. We do all of that all at the same time. We have a Polymem product just for tunneling wounds.
Oh.
It's our rope.
Yeah, let me feel that.
The most important thing about putting product in a tunneling
Wow.
wound is what goes in.
Must come
Must
out.
come out.
Yeah, absolutely.
So what we've done is we've put Polymem around medical grade mesh.
Oh, that's smart.
So what comes in must come out. nice buttonhole for application.
Oh, okay. So
Be able to put it in.
Oh, okay.
You can just buttonhole it and slide it in.
Oh, beautiful.
It looks very nicely. But it's Polymem, like we talked about before. So it has cleanser, glycerin, starch copolymer. The fluid that's in that tunnel is going to wick towards the surface of the wound.
Okay.
All the other rules are the same. You're going to change the dressing when the exudate hits the margin. You're good to go. If you have a cavity, we have our cavity filler. As you're aware, silver is our antimicrobial.
Okay.
So you would be using our silver dressing if you have severe comorbidities with a compromised immune system. If you think there's infection in the wound, or if you have an infected wound, we strongly suggest that you use our silver product. So this is our silver wick. It's our cavity filler.
Oh, okay.
So if you have a tunnel, yes, you use our rope product. If you have a cavity, you're going to use our cavity filler.
So it just fills the dead space
Fills
of the wound
the dead
like
space.
that. Okay.
Yep, about 70-75% of that dead space in the wound. It's non-linting, so you can just rip it apart or cut it apart, whichever is easier for you. You're going to cover the dressing, and you're going to change the wound.
Yeah.
When,
when you hit the
rules are the same because it's Polymem. Isn't that wonderful?
It is wonderful. It's easy to do.
What really makes this unique is that the action of all of the components in the dressing, along with the way that our matrix of our dressing is developed, inhibits nociceptor activity in the area of that, not only the wound, but in the area surrounding the wound.
Is that a fancy name for pain?
Yes, it's a fancy name for pain.
Okay.
We call it the swelling and inflammation.
All right.
Because part of the process that causes wound pain around the wound is that those tissues become inflamed and swollen, and that's what actually causes the pain in all those surrounding tissues. So wherever you have Polymem, wherever the dressing sits on the skin, here for example, if you have a wound right here and you have all that redness around it, we always suggest that you put Polymem way past those margins, those wound margins. Give it a little extra space there, because wherever the product is, it's going to react and it's going to pull sodium ions, minute amounts of sodium ions, to where the dressing is. It's going to interrupt that sodium-potassium balance that floods over the nociceptors, and it's going to quiet that nociceptor activity. So it doesn't have the same reaction. Your body won't have the same reaction and identify pain in that area.
So you're telling me it's going to treat the wound, but it's also going to treat my peri wound.
Correct.
I've never seen a dressing like that. This is awesome.
That's because it's Polymem.
Wow. In your opinion, what are the two biggest benefits for Polymem dressings?
The primary benefit from an organizational perspective is the risk management of Polymem.
Risk management.
Risk management to me, to an organization, is the huge benefit of Polymem. As we talked about at the beginning, Polymem can be used on all wounds throughout the entire continuum of wound healing. Polymem is Polymem. Each of the dressing has the same components. So if you put Polymem on a wound, diabetic wound, pressure ulcer, highly exudating wound, a dry wound, it's the correct dressing for the wound. So when you have your clinician at the bedside trying to make a decision about which dressing to use, Polymem is always the right answer.
So it'd be a no-brainer.
The second benefit is actually to the patient. It gives them some control in their wound care of knowing when to change a dressing. It diminishes the pain and the inflammatory response that they have inside the wound bed and the surrounding tissues, and it's a product that works.